With those cuts, Arkansans may start seeing significant changes to their health care coverage. 5 News reporter Kayla Davis is here now. And Kayla, how many Arkansans currently qualify for Medicaid?
Morgan, according to 2024 data from the Arkansas Department of Human Services, or DHS, 821,000 Arkansans rely on Medicaid. Healthcare advocates are concerned, saying it's not just individuals that will be impacted. Hospitals could also be at risk. A newly signed spending and tax bill dubbed the Big Beautiful Bill comes with nearly $1 trillion in cuts to Medicaid over the next 10 years. There are also new requirements for able-bodied adults to work 80 hours a month to qualify. With these new adjustments, Arkansas Center for Health Improvement claims Medicaid enrollment could go down by 14%, which means 114,000 Arkansans could lose their coverage. Kayla Kraus is a stay-at-home mom of 2. Both of her children require frequent medical visits.
My daughter has been in speech therapy for 3.5 years, and that is federally funded. She does 90 minutes a week. My son has to have developmental checkups every 3 months to make sure he's progressing at an accurate developmental scale. And my daughter also has very severe anaphylactic allergies.
Kraus says her livelihood may change amid this new law.
With job requirements, we want to make sure that our kids have insurance, as it's not a feasible option through my husband's job, which looks at, me working at Target or at Walmart from like 11 p.m. to 6 a.m., which means, I get a 1 or 2 hour break before I jump back in and take care of the kids.
Arkansas Advocates for Children and Families says these changes will impact rural areas the most.
If you are someone who doesn't use Medicaid and SNAP, but you may lose your closest hospital, what does that mean in terms of healthcare costs for you, in terms of you having to travel further in order to access care? That is a significant thing that people may not be thinking about today, but we will have to think about soon as hospitals are trying to determine whether or not they can keep their bottom line.
But says they're currently working on solutions.
Making sure that Arkansans that rely on these programs know what to expect, know what the new requirements are, and know how to meet them. Because we have seen with our last round of work requirements, and also when we did Medicaid unwinding, we saw qualified individuals be removed from the program due to no fault of their own or because of misunderstandings about the program requirements. And we do not want to see that happen.
States must have tracking and compliance systems in place by the end of 2026, with work requirements for able-bodied adults taking effect on January 1st, 2027. Kayla Davis, 5 News.